15% of adults have gallstones. A higher percentage have gallbladder sludge. Here's a key point that provides a target therapeutically. Quoting a 2023 review paper, in recent years, the gastrointestinal microbiome has emerged as one of the critical regulators of gallstone formation. Some of the symptoms of gallstones and gallbladder sludge include pain or discomfort that's mainly consolidated to the upper central or upper right quadrant of your digestive tract, so on your side. Fat intolerance, floating stools, reflux, nausea, vomiting, and indigestion. These are all symptoms that risk eventual gallbladder removal, and also that there are currently stones or sludge present or in development. Let's discuss today what you can do to care for your gallbladder, and also if you've had your gallbladder removed, things you can do to optimize bile function. If you're new here, welcome. I'm Michael Ruscio. I'm a doctor in clinical practice. I also work as an adjunct professor and as a clinical researcher with a few papers published and more in the works. Let's now develop a key point. This key point is the microbiome is a major regulator of bile and gallbladder health. You see, we might think that the gallbladder, which stores bile that's made in the liver, simply squirts its bile into the small intestine and helps with digestion, and then that's sort of it. That's not actually the case. There's this very important recycling loop where the bile made in the liver, stored in the gallbladder, and secreted into the small intestine is then recirculated after it's metabolized by your microbiota. So the microbiota holds promise to modulate the metabolism of bile, which is a major underlying risk factor for the formation of stones and sludge. Taking a little bit of a closer look at this, bile made in the liver, again, just recapping here quickly, stored in the gallbladder, secreted into the small intestine. The small intestine is where 95% of nutrients and calories are absorbed. And this includes fat with some major assistance from the bile. 5% of the bile, only 5%, but 5% then makes its way into the large intestine. And this is the crucial piece. Even though it's only 5%, what happens to that 5% plays a very large part in determining if you have a reabsorption loop that pushes you progressively towards stone formation or sludge formation or does not. Technically, this is known as conversion of primary bile acids into secondary bile acids. Now, some of this conversion is okay, but if that conversion into secondary bile acids is more than it should be, this poses a major risk factor again for gallstones and gallbladder sludge. And the risk determining factor, so to speak, the regulator of that conversion from primary to secondary is your microbiota, the world of bacteria in your large intestine. Let's put a data point up on the board here, so to speak. 2020 study looking at gallstone patients versus controls. Now, the patients with gallstones had dysbiosis, so they had alterations, unhealthy imbalances in their microbiota. This dysbiosis was partially comprised of higher levels of bacteria that are known as lithogenic, meaning they form secondary bile acids and therefore run the risk of gallstones and gallbladder sludge. And also, as you would expect, these people had higher levels of secondary bile acids, leading these researchers to conclude that intestinal flora imbalances affect bile acid and cholesterol metabolism and is associated with gallstone formation. Now, also look at this. When another group of researchers took the bacteria, the microbiome from humans that had gallstones and transferred that into mice, the mice began forming gallstones. So we know that not the only factor, but a major factor, and thankfully a modifiable factor in gallstones and gallbladder sludge is your microbiome. And if you're new here, if you wouldn't mind commenting, liking, or subscribing, this provides the channel very helpful support to reach and to help more people. Okay, so we just discussed the very crucial role the microbiome plays. There's one other component that we should cover, which is the production of bile itself. Because there is such a thing as bile that becomes thick, viscous, stagnant, and because of that, clogs up in or sort of stagnates, hangs around in the gallbladder, and then forms stones and sludge. Why this is so problematic beyond the obvious is because not only will that thick, viscous, stagnant bile risk the stones and the sludge, but that bile needs to get out into the intestinal tract because it helps with motility or the movement of food through the digestive tract. It's also antibacterial and it's anti-inflammatory. So making sure that not only do we have a healthy microbiome to help with that recycling and making sure that you're not forming an excessive amount of secondary bile acids, but also that the bile itself is flowing. These are probably the two most important factors for gallbladder health and longevity, if you will. Data point here, 2014 observational trial, looking at 183 patients with gallstones compared to 150 healthy controls. The gallstone patients had slower motility, so you could say they were more constipated, and they also had higher levels of SIBO, small intestinal bacterial overgrowth. The gallstone patients had a prevalence of 15%, or there was a 15% finding of SIBO. The healthy controls, 0.7. So that is a large difference in the level of SIBO, which makes sense when considering these two major keys that we're developing. One, the microbiome and its effect on metabolism. And two, the impact of bile being pro-motility, which prevents SIBO, and antibacterial, which discourages SIBO. We can now take these two observations, the microbiome and bile flow, if you will, and use those to create a protocol to support these two facets. So firstly, how do we support a healthy microbiome so that we are converting and creating the appropriate amount of secondary bile acids? Probiotics. Quoting a 2022 randomized control trial in this case, we believe that intestinal probiotics may be an effective therapeutic drug for inhibiting gallstones. In their study, they took gallstone patients, they gave them probiotics for 2 weeks, and in only a 2-week interval, they were able to measure and demonstrate that the people taking the probiotics formed less of those pesky secondary bile acids. The probiotic protocol that we recommend is triple therapy. Rather than going into all the details, I'll just say here, kind of high level, that we recommend using more than one probiotic formula. So you have essentially a super probiotic, if you will, 3 formulas simultaneously. This seems to be more effective, but if you want our evidence-based, what we term meta protocol, in terms of the 3 main formula types, along with the corresponding dosages, we will provide those details in the description. Another point regarding modulation of the microbiome or microbiota is fiber. Quoting another research paper, for every 10 gram per day increase in dietary fiber, the risk of gallstones significantly decreased by 21%. Now, in this study, they looked at over 8,000 patients. And the important thing here is they controlled for a number of confounding variables: people's weight, their total cholesterol levels, HDL cholesterol levels, their hypertension or high blood pressure status, if they had diabetes, coronary heart disease, their smoking status, if they were sedentary, their total caloric intake, their carbohydrate intake, their fat and protein intake. When controlling for these other variables that can influence this picture, there was still this direct relationship between higher fiber consumption and lower gallstone risk. The other side of that coin, so to speak, is a higher consumption of refined carbs, increased risk. Just in brief, a few options regarding how to increase your fiber intake, a few foods to consider. I understand that different people are on different diets, and so these are just suggestions to try to work within whatever dietary framework that you're currently using, assuming that people are, hopefully anyway, temporarily using some sort of specialty diet to improve their health as a stepping stone to sort of a broader, whole food-based, nutrient-dense diet that definitely has some room for nuance. That being said, legumes like lentils and black beans, flax and chia seeds, avocados, raspberries, broccoli, Brussels sprouts, quinoa, and barley are all great sources of fiber. And if you're looking to do this via some sort of gluten-free bread, there's a couple options that I like. Carbonate and the Grain Escape have good high fiber breads that are also gluten-free. So if you're trying to get a sandwich in or whatever you're trying to do it gluten-free, but also optimize for fiber intake. Those are two options there, as well as a flax cracker from the brand Flackers. We have no affiliation with these companies. These are just ones that we found were simple ways to increase your fiber intake through a bread product. Okay, so we've talked about options to modulate the microbiome, probiotics, and your fiber intake. Now let's talk about what we can do to support healthy bile balance. Because remember, there's this primary and secondary bile acid issue that we also discussed. Supplementing with a bile acid isolate known as TUDCA can be very helpful. What's interesting and I think novel about TUDCA is it's also anti-inflammatory and it's even neuro-anti-inflammatory, in addition to having some mitochondrial health promoting effects. Milk thistle also helps to reduce cholesterol in the bile, which is a risk factor for stone formation. And healthy fat intake. The take home here regarding dietary fat is too much or too little fat are both problematic. Like so many things in biology, there's sort of this sweet spot. Intuitively, this should make sense regarding if you're eating very low fat, there's very little stimulus for the gallbladder to be releasing its bile. Therefore, in a way, you have this stagnancy of the bile because you're not eating enough fat to trigger it to release the gallbladder to release its bile content. Conversely, too much fat may pose the same problem in being overstimulatory to bile release. There are some fats to think about targeting, fats from oils, nuts, fatty fish, and plant-based omega-3s. So some examples: olive oil, avocado oil, fish oil, almonds, hazelnuts, pistachios, macadamians, salmon, sardines, mackerel, trout, ground flax, chia, and hemp seeds, just as sources of dietary fat to incorporate. We discussed microbiome balancing, bile acid balancing regarding primary and secondary bile acids. Now, the third and final piece is bile flow. There's one interesting supplement here from a company called Standard Process. The supplement is AF Beta Food. It contains a blend of nutrients, herbs, bovine organ extracts, and other botanicals. They published a randomized control trial in which they documented a decrease in gallbladder wall thickness, which accompanies inflammation and gallstone and sludge formation, and better gallbladder volume post-meal. And most importantly here, they had a improved ejection fraction from their gallbladder. There are other similar supplements to consider. Digestive bitters are also a great idea. Things like dandelion, gentian, artichoke all help stimulate the release of bile and partially thin the bile. Coffee indirectly stimulates bile release. And also taurine and glycine supplementally can function in the same fashion. You wouldn't have to use all of these. This is what's nice about AF beta food. It integrates a number of these together, but these are all options that can be used as part of a bile flow and production support approach. A few final points. I wanted to speak to if someone has had their gallbladder removed, because in roughly 30% of people who've had their gallbladder removed, they can form what's known as post-cholecystectomy syndrome, where people start developing digestive symptoms after the gallbladder's been removed. Most of the time, this involves diarrhea, but some of the times it involves other symptoms like pain, bloating, nausea, heartburn, and reflux. The challenging thing here is there are two schools of thought on what you should do after having your gallbladder removed. One school of thought is replace. Take an ox bile supplement, take a TUDCA supplement. Give the body what it may not have enough of, bile. The other school of thought is to bind bile. And they're complete opposites, obviously. What's challenging is, as is in many sort of contentious areas, there's merit to both of these perspectives. Let me give you kind of the breakdown. When you have your gallbladder removed, you still make bile. It's just the bile gradually trickles into the small intestine. And for some people, that creates an overwhelm of bile. And because bile is pro-motility, meaning it makes things move, if you're overwhelmed by that bile drippage, that can lead to excess in motility or an excess in motility, therefore diarrhea. So this is where binding actually has merit. And there's clear evidence that for some people, binding bile with something like charcoal, psyllium, or the medication cholestyramine definitely help. But for people who do that and notice no change, or maybe even symptoms worsening, then giving bile may help. Now, there's another nuance here for those of you who have had your gallbladders removed and developed symptoms subsequent to that. If your only symptom is diarrhea, then it's more likely, this is not definitive, but it's more likely that the bile binding with psyllium, charcoal, and so on is the right approach for you. But if you're having these other symptoms that suggest you're not digesting fats appropriately, that's where replacement has more merit. So if you have nausea, vomiting, bloating, floating stools, all these are suggestive that TUDCA might be a good idea. You can use TUDCA. You can also use an ox bile supplement. I think either one is fine. They're both inexpensive enough. Trialing one independently for about a week, then the other, and comparing which one gives you the best results is probably the most practical way to approach this. But there's one other support that people who have this post-cholecystectomy syndrome should consider, and that is a vitamin cocktail, courtesy of a 2004 clinical trial in about 50 patients with post-cholecystectomy syndrome. All of these people in this study were deficient in magnesium. So that's sort of one flag that, hey, there might be a need for some sort of vitamin intervention, and that's part of what prompted this study. Also, 1 year into treatment, 50 of 52 people had full resolution of their symptoms with a simple protocol involving the following: magnesium, methionine, calcium, vitamin B1, and vitamin B6. Now, there is not one supplement that has all these things included, but we will link to the specific dosages, the specific vitamin types, and a few product links in the description of this video. Here is another really key point, quoting from the paper. Discontinuation of the supplement allowed for recurrence of clinical symptoms, which subsided again after the treatment was resumed. Meaning, this doesn't seem to be corrective, unfortunately. And when people stopped, their symptoms returned. But thankfully, when people resumed the supplements, their symptoms went away. For those who have had their gallbladders removed and have developed symptoms, a couple things to consider. Replacement with either TUDCA or bile, absorbing or binding with cholestyramine, psyllium, or charcoal, and a nutrient replacement protocol like we just outlined. And if you're trying to get definitive answers for those who have their gallbladders, what the status of your stone or sludge formation currently is, and what your ejection fraction or flow looks like, ultrasounds can check for the one, and a HEDA scan can check for the other. I hope this helps you sort through some of what you can do to prevent the formation of stones and sludge. And also, those same preventative measures do seem to be able to reverse stone and sludge formation. We don't have much research there, but there's some inferential data that I think supports that. And then also, if you've had your gallbladder removed and have developed symptoms after that, what you can do there also. If you get stuck, feel free to reach out to the clinic. We are always here to support. And I wanted to just briefly close with a story that was sort of motivating. Halloween was about a week ago. And at the end of the night, we ran out of candy. A little boy came up, said trick or treat. And sadly, I had to inform him that we were out of candy. He put down his sack of candy, reached in to grab a massive scoop and put it in our bowl so that other trick-or-treaters would have candy. And I just found that to be such a wonderful display of charity and thought I would share it here because it just made my day. And so I thought I would share it with you. In any case, coming back to the issue at hand, if you are having issues with your gallbladder, I hope this helps. And if you do have questions, please feel free to comment below. This is Dr. Ruscio. I will talk to you next time.